figures have the potential to quickly overwhelm our health facilities. We must not allow this situation to happen. I'm therefore appealing again to all Kenyans that in order to try to manage these numbers, to keep down these numbers as we move along, as far as possible, flattening the curve and pushing it to the right as far as possible allows us to be able to deal with those cases that come up that need clinical management, given our capacities of our health systems. We need to manage that, and the way to manage that is through the containment measures that have been put in place. I appeal to my fellow Kenyans that we must more than ever now strictly adhere to the containment measures that have been put in place. That is the strict observance of hand washing and hygiene, social and physical distancing, wearing masks, avoiding gatherings. All of these measures will be able to allow us to push this curve so that we can be able to deal with those that turn out positive and those that need clinical management. The positive cases now push our cumulative numbers to 4,044 out of a total of 124,474 samples that have been tested in the country so far. In terms of gender, 129 of the cases today are males, while 55 are females. And all of them except one are Kenyans. The 184 positive cases are distributed in counties as follows. Nairobi has 111 cases, Mombasa 19, Kajiado 14, Meru 13, Kiambu 9, Busia 6, Nakuru 4, Machakos 3, Kwale, Kisumu, Garissa, Taita Taveta, and Vihiga counties, 1 case each. The last county, Vihiga, now becomes the latest county to record a COVID-19 case, bringing the total number of counties so far affected to 40. By sub-counties, the cases are distributed as follows. In Nairobi, there were 33 cases in Westland, 19 in Kibra, 18 in Langata, 15 in Embakasi East, 12 in Dagoretti North, 4 in Kamkunji, 2 in Makadara, 2 in Starehe, 2 in Embakasi Central, Roysambu, Embakasi West, Kasarani, and Embakasi South had 1 case each. In Mombasa, the cases are from Mvita, 9, Changamwe 4, Likoni 2, Nyali 2, Jomvu and Kisauni, 1 case each. In Kajiado, we have 12 cases from Kajiado Central, Kajiado East and Kajiado North, 1 case each. In Meru, the 13 cases are all from Imenti North. And in Kiambu, the 9 cases are from Lari 3, Juja 2, Kabete, Kikuyu, Kiambu Town, and Limuru, 1 each. In Busia, all 6 cases are of truck drivers in Malaba and Matayos. 5 in Malaba and 1 in Matayos. In Nakuru, the 4 cases are from Naivasha, 3, Nakuru East, 1. In Machakos, all 3 cases are from Athi River, while in Kwale, the 1 case is from Lunga Lunga. In Kisumu, the 1 case is from Kisumu Central. In Garissa, the 1 case is from Garissa Township. And in Taita Taveta, one case is of a truck driver. In Vihiga, the case is from Vihiga town. On a positive note, we are glad to report that today we have discharged 27 patients from our various facilities, bringing the total tally of recoveries to 1,353. Sadly too, we have lost 2 more patients to the disease. The total number of fatalities now stands at 107. And again, we express our deepest and heartfelt condolences to the families and friends of the bereaved during this trying moment. Fellow Kenyans, as we have observed, our numbers of positive cases are steadily rising. And it is a matter that we all need to be concerned about. This further confirms that community transmission is now quite well established within the country. As we try to trace and treat, testing becomes a cardinal feature of the strategy of our response. Testing and accuracy of testing will become increasingly important as these numbers continue to rise. And I want to take this opportunity to talk about observations in this area that are concerning us. We have noticed, for instance, that several testing kits that purport to diagnose COVID-19 have permeated our market. I think this is a matter that needs to be addressed, and I want to say a few words about this. First and foremost, the standard test that the ministry uses as a diagnosis of COVID-19 is the real-time PCR test based on detection of nucleic acid of the virus. That is the only test that definitively identifies the presence of coronavirus in those that turn out positive. We have talked about this issue before. That's the valid test for diagnosis of COVID-19. Yes, there are other tests that have been developed since then that are not based on detection of the nucleic acid, but are based on detection of either antibodies that a person may have raised as an immune response to exposure to the virus. These are the so-called antibody-based rapid diagnostic tests, or RDTs. And it is these RDTs that concern us, because these RDTs that have permeated the market and are being vended out there and are being presented as a test for diagnosis of COVID-19 is incorrect. As far as the position of the ministry is concerned right now, the only test that can diagnose and state that an individual is positive for COVID-19 is the real-time PCR test. The ministry has approved, in addition to its own laboratories within the ministry, the National Public Health Laboratory, within the Kenya Medical Research Institute, and other partners, and a few partners in the private sector that include the big hospitals such as Nairobi Hospital, Aga Khan Hospital, and a few other private labs. So there's a select number of approved facilities by the ministry that offer this real-time PCR-based test. The RDT test is still under consideration. Even WHO has not provided any guidance yet on the RDT tests because, one, they are not sufficiently sensitive and specific to detect what they have been developed for. And number two, their use in diagnosis of COVID-19 is still uncertain. These RDT tests, however, do tell something when they work. And what they tell you, the test when it turns out positive, what they tell us is that that individual was exposed to COVID-19 and therefore mounted an immune response, resulting in antibodies within the person's circulation, and that is what is picked by the test. It does not tell you if the virus is present and active within that individual. So these tests cannot be used for diagnosis for now, until further information is received in terms of exactly how they perform and what it is they detect. And that's the reason why we say any of those tests are not a test for COVID-19 disease. And I want to tell Kenyans also who are being told that they will be tested for COVID-19 using these 15-minute, very quick assays, rapid tests where a puncture is made on your fingertip, a drop of blood is drawn out, put on a cassette, what they call the lateral flow systems, and then you see a band. I think all of you are familiar with the test for malaria. Each one of us must have gone through that one time or other. This test for COVID, which works in that fashion, is not the right test. That is not to say that these tests do not have value in terms of telling us something. Indeed, for now, they do have value because they can tell us the level of exposure within a community or within a population. And therefore, they have been authorized for use for purposes of surveillance and research. And in fact, as a ministry, we plan to use some of these tests just to do surveillance so that we get an idea of the level of exposure of coronavirus in our communities. So what I want to state here is that for Kenyans, please do not take those results as of an RDT test for now, giving you the comfort that either you are negative of COVID-19, or in some cases giving you the anguish of telling you that you are COVID positive. The only test that is accepted and the gold standard for COVID-19 right now is the real-time PCR test. Secondly, for those who are vending these tests, we also want to caution them not to misrepresent the utility of these RDTs in diagnosis of COVID-19 disease. Equally, to our own regulatory authorities, we will in the coming days be streamlining the processes of having these tests on the market and determining exactly for what purposes they can be used. I also want to add on to this discussion today the issue of quality and accuracy of testing. With many labs providing a test such as the RT-PCR, we have heard of cases where tests in one lab turn out one way, when taken to another lab, they turn out another way. These, we believe, are issues to do with quality or handling of the material, the virus transport media, the processes involved in extracting the nucleic acid, and the quality issues around the samples and the testing procedures. As a ministry, we have put in place a QA system, quality assurance system, that will be able to ensure that all these labs can be monitored in terms of their quality of tests that they are providing, because the quality assurance systems will be able to determine how good a lab is in returning the correct result. And these quality assurance protocols will be put in place in the very near future so as to remove that ambiguity of test results. Where labs that are approved fail to consistently meet a certain quality level, then appropriate action will be taken as well in ensuring that they take corrective measures to be able to provide the right results, or any other action that may be deemed necessary at that time. I would like to stop at that, and I want to thank you, but we shall take some questions. I have my colleagues here who will be able to respond to some of those technical questions that you may have. Thank you.
My name is Sam Gituku from Citizen TV. I have a few questions. And first, it's the first time that we're recording 111 infections in Nairobi. So when you look at the trend, how would you say the trend of infections is? Because containment measures have been communicated, but the numbers continue to rise. What are the behaviors that you're observing? Secondly, there's a drug, dexamethasone, if I got that pronunciation right, and there are some tests that have been done in the UK indicating that they help to reduce the fatalities, especially for critically ill patients. Are we doing such kind of trials in Kenya? And if yes, do you have enough stock that would be in a position to take care of such patients? And finally, this week alone, we have recorded 450 cases. Would you know how many of these have already been admitted in hospitals? And how are we doing in terms of the people that are in hospitals currently?
My name is Angela Okech, Daily Nation. In regards to our sportsmen and women in the country, is there a protocol by the Ministry of Health that would allow them to travel and participate in most of the sporting activities? Now that we are seeing that the world is opening, the sporting activities are coming up. Then my second question, what is the status of the patients who are tested positive in State House? Is the Ministry of Health doing contact tracing? And is it true that Kinuthia Mbugua is admitted at Aga Khan Hospital? Thank you.
My name is Graham Kajula from The Standard. My question is with regards to the status of COVID-19 among prisoners and the disciplined forces. And where are we now at the moment in contact tracing? How many people have you been able to trace? And how many of these of patients who have tested positive you've not been able to get in touch with?
Asante sana, jina langu ni Manuel kutoka KTN News. Swali moja tu, tumeweza kuona mikahawa ikiongezewa muda wa kuhudumu hadi saa 1:30 usiku. Je, ni watu wangapi wameweza ama wahudumu wangapi wameweza kupimwa na kuhakikishwa kwamba wamepata leseni ya kuhudumu, na ni wangapi walifeli katika mtihani huo? Asante.
Okay. Thank you. Let me respond to the first question in terms of the trend of infection and where we are now. As I said earlier, we have been presenting daily 24-hour reports. If we look at our curve, we are beginning to see that the numbers are beginning to rise. We are no longer on that steady incline. We seem to be taking a curve and moving up. And we do expect that at some point we will have to hit our inflection point, move up quickly and reach some peak and then come down. So we believe that this may be the beginnings of our inflection point where we are rising. So in terms of trends of infection, we expect that we may see rising numbers. Why are we also seeing rising numbers? Well, yes, containment measures have been in place, but you will agree with me also that adherence to containment measures have also somewhat waned over the past several weeks. We are all human beings, I know, and we do feel that at some point a lot of these constraints, people may want to get away from some of these constraints. We're beginning to see this, and that is why every day when we come up onto this podium, we appeal to fellow Kenyans that we cannot slacken on this. If we slacken, if we begin to fill up our matatus without any respect to the distancing measures that we've put in place, if we begin to congregate and meet in places, we will certainly see an increase in numbers. You all know the examples of countries that have managed to contain this virus, almost contain it, and then suddenly they relax some of the conditions, open up worship houses, or remove some of these measures, and we suddenly see an increase in the number of infections. This infection is transmitted from person to person through contact of surfaces that are touched, and therefore it needs that mode of interaction to be able to be transmitted. The containment measures work on breaking that mode of transmission by preventing one person passing on the virus to another person. The masks do that, the distancing does that, the physical distancing do that, the hygiene measures do that. They break that cycle of transmission. So we should not relent on breaking that cycle of transmission. That's the only way that we can control this virus. Eventually this virus, the curve will rise, but these containment measures will allow us to be able to manage how this curve rises such that it does not overwhelm our health systems. I think that is the entire strategy of the response against this virus right now. There was also a question on the dexamethasone. It's called dexamethasone. It's a steroid, commonly used steroid actually, for anti-inflammatory conditions, widely available and quite a cheap drug. Yes, indeed, there are some findings of limited clinical trials that report some level of impact of this drug when given to COVID-19 patients, especially those who require either additional, to be provided with support in respiration. It's an exciting finding that most of the countries are now looking at, and it comes on the heels of dubious findings regarding the other proposed therapy for this condition, that is the chloroquine azithromycin mix. So I think everyone is excited about this and needs to know whether it indeed works. What I can say is that this is a limited study. It had a limited number of patients that were looked at, but clearly among those limited number of patients, there seemed to be some level of improvement when given this drug. So I anticipate that in the coming days we will see many more large-scale trials that will explore this particular drug further. The WHO-sponsored Solidarity trials, which was looking at about 4 arms, I'm sure will now be considering this as one potential arm. In fact, this morning we have had discussions with the clinicians here to see whether it is something that we may want to very quickly set up our own clinical trial to look at the efficacy of this drug. So there's some level of promise, but there's quite a bit of research and clinical trials that need to be done. Of the 450 cases that we have, how many are hospitalized? I will leave that to the DG to respond. He has those figures with him. Angela, your question was regarding protocols for our athletes and sportsmen with the relaxation of these protocols in many of the other countries. I think these are matters that are continuously being looked at, because it is not only in the sporting arena, but also in the other economic activities where we know people have suffered for a long time. People need to go back and do some of their things that they do for a living. whether it is an economic activity or whether it's a sporting activity. And I am sure that there are considerations in determining what kind of measures can be put in place to begin sports, prepare our sportsmen to participate in their vocation. There will be, I think the approach we'll look at, one, is it our domestic sporting activities, or are we looking at allowing some of our renowned athletes to be able to participate in international meets? I think these issues are being looked at in conjunction with the sports ministry, and some form of a solution will be developed, particularly for those external meets where we want our renowned athletes to participate in. Yes, then there was a question about State House, positive cases in State House and what we're doing. I don't think I have that information with me, or I'm privy to that information to be able to discuss it here. But what I can tell you is the strategy of the ministry is to identify, trace, and treat. That is the essence of the response. So if through the testing processes a positive is identified, it follows that there must be contact tracing of that positive case, because that's the only way you can follow the transmission chain and bring it to a stop. So that continues. Anybody who's positive, whether if you are in State House, or you are in the discipline forces, or you are in any other place, you are in Parliament, the process will proceed, and contact tracing will proceed. I cannot comment on the issue of State House comptroller, and mentioned something about being hospitalized. I can't comment on that because I do not have that information. So COVID-19 in disciplined forces, I will allow maybe Dr. Kuria to comment on that. The final question was regarding restaurants and their hours of operation having been extended to 7:30. I think the CS made that announcement yesterday. So in terms of determining how many of these now have qualified to operate under those conditions, we had put in measures, requirements for restaurants and eateries to be able to operate. The key requirements that we want them to observe is the containment measures of distancing, hygiene, wearing a mask, yes, and testing when we feel that there is a need for that test to be conducted. In this sense, I think there has been some reconsideration of some of the earlier requirements that we had put in, but I will allow Dr. Kuria again to be able to respond to that regarding the restaurant workers. Let me first hand over to Dr. Amot.
Maybe Kuria can go in first.
Okay, Kuria can come in and respond to these last few questions, and then we shall allow Dr. Amot to go.
Thank you, Mr. Rashid. I think the first one on the issue of security personnel and prisons personnel. Some of the figures, like the number of security personnel affected by COVID-19 and any other illness, you may well be aware that some numbers are restricted. The information is restricted. But we can confirm, yes, COVID has not spared the security forces and the prisons. But I can inform you confidently that there are very stringent measures to isolate and treat those that are affected. And the security forces, and indeed the prisons, have identified isolation facilities that they are using, and they have a very elaborate contact tracing mechanism, and this has been going on well. On the issue of hotel workers, I cannot give authoritatively the number so far tested countrywide, but it's quite a huge number of hotel workers that have been tested, and that the positivity rate among the hotel workers has been relatively low, almost negligible. So those that have tested positive, I don't have the actual number because the numbers keep coming. Quite a large number tested, but the positivity rate is fairly low. That is, but no, I cannot give the exact figures at this moment. Maybe we can share this in the next Paresa, like tomorrow we can get the actual numbers that we can share. Thank you for that.
Thank you, CAS Dr. Rashid, my colleague Dr. Kuria. Allow me first of all to start by just giving additional information regarding the use of dexamethasone in the study that was done at Oxford University in UK, also known as the Recoveries study. For the deployment of dexamethasone, it will apply to those who are critically ill. And in this group of people, a third of them, dexamethasone reduced the risk of death in a third of the cases tested for those who are on ventilatory support, but reduced the risk of death by 1/5 or 20% for those who are on supplemental oxygen. As Waziri said, dexamethasone is a cheap drug, readily available. It is listed under the WHO Essential Medicines list. It is also listed under the Kenya Essential Medicals list 2019. And because Kenyans have this tendency of rushing over to the counter to buy any medicine, let me just point out a few side effects of the dexamethasone that they need to be wary of so that they just don't go to the pharmacy or chemist and simply ask for a prescription or a refill of dexamethasone. One of the side effects of dexamethasone, of course, is fluid retention. And accompanying that is that you'll gain weight. Your blood pressure could also go up. If you are diabetic, your blood sugar would go up, and therefore if you are on insulin or the oral medicines for treating diabetes, you will require a higher dose to be able to control your sugar. It will also affect your moods. It can cause depression, and it can also affect your sleep pattern. So any person who is taking this particular medicine must be wary of those side effects. Regarding the total number of patients, as of today, we have 548 patients admitted in various hospitals throughout the country. 5 of them are in critical condition, 3 under ventilatory support, and 2 are getting supplemental oxygen. The rest of the patients are asymptomatic and just being observed. Again, therefore, that means if you are to deploy dexamethasone, because as at now 88% of our people, of our cases, are asymptomatic, it means this medicine will only apply to a very small fraction of our cases. So, in essence, this is to tell you that there's still no cure for COVID, and therefore we need to continue with the containment measures that we have put in place, including the infection prevention control measures of hand washing, respiratory hygiene, use of hand sanitizers, use of masks in public places, physical and social distancing, and of course avoiding overcrowded places. So these still remain the key, even as dexamethasone offers a promise. Again, based on what Waziri said, remember chloroquine was also like that. We are excited. Then when we receive the full data sets, the situation changed. So let's wait for the scientists to be able to review the full data sets at the end of the month. Then we can conclusively say that this is a potent arsenal we can be able to deploy against this enemy. Regarding the patients who have tested positive in the course of the week, about 450, remember that now we have established community transmission in quite a number of counties, and most of the figures are now coming. Of course, Nairobi and Mombasa still lead, but quite a number of figures come from the counties. As of the data we had this morning, out of this number, about 120, 130 had been admitted. and we'll be able to collate the figures after getting all the information from the rest of the reports from the counties. Therefore, by the end of the day, we should be able to update to see how many of these people who have tested positive have been brought into isolation center. Going forward, once we digitize our system and roll it all over to the rest of the counties, it will be real time so that every morning when we receive the figures will reflect the true position of what is happening throughout the country. Thank you.